Hey Mama, I'm Chinny, aka Mama Mayan, birth doula, childbirth educator, and all-round support for Mama. So thank you for your inquiry, and I'm here to respond in this video to your inquiry for either a home visit, either a birth doula, or for training for birth. Now, I support families to train for birth, whether that be the partner, whether that be the partner in collaboration with Mama or the whole family as a whole as to how best they can support Mama. About the birth doula services, every birth is different. And so we like to give our quotes based on the individual couple needs or based on the needs of the individual mama. But you can just pen down that our doula services start from $1,700, and it depends on what we are agreeing to. It depends on how long you would need my services for. It depends on how long you would need me prior to the birth. Am I just attending in the hospital? Is there postpartum services involved? All of it is tailor-made to your unique experience and your unique needs, and of course, with your comfort as our utmost concern, and of course, the safety of both mama and baby. So regarding our home visits, we charge $500 for a home visit. Now, in this home visit, we give 3 hours of undistracted pause time where mama is put in a position for having the birth that they desire, that she desires. So we start this at 34 weeks plus. And so the idea is to train for birth, get the body ready, get the body moving, get the muscles moving. And so this is enjoyed from the comfort of your home. Why is this training important? This training is important because sometimes the body needs to be engineered into a position that the body is ready for birth. What exactly does this even mean? Take, for example, when a baby is not in the right position. So if a baby is transverse or if a baby is breached, for example, there are exercises that mama can be supported to do to get baby to move. And sometimes mama has a bit of stiffness in the pelvic area and does not have enough room for baby to maneuver. The purpose of having a trained doula work with you is that we are able to help you in those positions, not just the physical support, but also the technical support. And why is it technical? Because there is a knowledge and understanding that is brought to how long these positions need to be performed for. If the positions are done in the right positioning, if you're at an incline, do you need supports to be held up because you're heavily pregnant? So your doula is able to physically be there with you and help you through these maneuvers, and is also able to judge for how long you need to be in these positions, is able to check your posture, is able to see if there's any stiffness, if there's any pain, and if there's anything overall that she can do to improve mama's comfort and of course keep baby safe. So if you're interested in this, please respond back via, I'm not sure how you're receiving this message, if it's from the website, if it's from Instagram, if it's from a one-to-one chat, wherever you're receiving this from. If you're interested in these home services, please respond. The second option, which is a less preferred option, but is an available option, is the virtual training for birth option. This virtual training for birth option allows you train virtually online with the guidance, obviously non-physical guidance of me as your doula for $299. For this session. And in this session, it's the same as the in-person session. It spans from around 60 to 90 minutes virtually, teaching mama the positions that she can practice by herself to get ready for birth. So why do I say that the virtual is not preferred? Because sometimes your doula, I, as your doula, am able to examine exactly what's going on with your body. Of course, doulas are non-medical and don't give medical advice, but there is an experience that comes with working with moms and working with women that have birthed, and especially with the labor preparation experience. And so, yes, you can walk by yourself, you can go on the curb, you can do these positions by yourself, but sometimes there's an extra push and support that having a doula gives you to just make sure that you get the results that are required for either learning labor positions, for either learning how best a partner can support you for your birth, or even just training and practicing in preparation for me being present at your birth as your birth doula. And so it's kind of like when you have a wedding and you have a wedding rehearsal. This is not an exact copy and paste example, but there's a rehearsal for a reason, because you want mama to be in the right frame of mind on the day of labor, because this affects everything. Now let's talk about what happens when mom is afraid. There is something called the fear, tension, pain cycle. So when mom is afraid, adrenaline is produced, and so adrenaline stops the function of oxytocin, for example, which is the love hormone, which is a hormone that you feel when you're with your partner or when you just hold your child in your arms for the first time. And the love hormone, oxytocin, is so important in progressing birth, in the softening of the cervix. Then we talk about endorphins that make mama feel good all around, which is God's own way of a natural pain relief. So when there is fear, adrenaline stifles the productive hormones that help all round in making sure that mama is able to have a blissful birth. So when you have a rehearsal, mama is in the mind frame of understanding that this is what needs to happen. This is where we need to be mentally. This is what needs to happen physically. And she is assured of the support that she has on D-Day, which is Labor Day, which is the day that she gives birth. And so we're able to train you in the different positions for birth. We're able to train you in natural methods of pain relief, relaxation techniques, breathing techniques. All of these things I will train you and teach you in preparation for birth. Now, if this sounds like anything that you need, if you're afraid, if you're thinking that you don't want to be going through things alone, if your provider has been putting unnecessary pressure on you and you feel like you're not certain how safe you are in their hands, then I would encourage you to consider me as your birth doula. Everyone knows that we have the internet, you have YouTube, so one might ask, but we have the internet, we have YouTube. Why do we need a birth doula? Why do we need a birth preparation doula? Why do we need training for birth? Because it is tailor-made to you, mama. It's tailor-made to your temperament. It's tailor-made to your unique pregnancy and your pregnancy history. It's tailor-made to your unique experiences and what your body is able to handle as far as the threshold. Now, some women have a high pain threshold, some other women don't have as high a threshold, but we are able to assess this through different training techniques that we deliver as doulas. So I encourage you to ask questions. Is there anything else I can help you with? Are there other questions that you have about my services? And we can take it from there. I am so glad that you're considering having me as your doula, either your birth preparation doula, your labor prep doula, or as your birth doula. And I look forward to hearing with you and hopefully working with you, serving you and supporting you. Take care.